Thank you, Chairperson, and I too would like to welcome the guest speakers here today and thank them for their contributions, and I'd also like to welcome with everybody else here the opening of schools and express the hope that that will remain the case going forward. We all know the impact that the school closure has had on many of our pupils, and I think students with special educational needs have been disproportionately impacted by school closure in many cases. I want to first of all express concern with the lack of information pertaining to children with SEN in the roadmap for reopening to schools. And in fact, I felt there should have been a link to child development teams or to NEPs within that roadmap, and that wasn't the case. I know a lot of therapies that are normally offered to children, such as occupational therapy and speech and language and physiotherapy, were not offered over the COVID period, or were, if were, in a very limited fashion. And I know other years a transitional report would have been prepared with the student who was transitioning from, say, primary school into secondary school, with the child development team, and would prepare students for that transition, prepare parents on how they should support the student, and proved invaluable to schools. I'm just asking, are you aware if that report was actually done with students this year? I believe it hasn't been, but I'm open to correction. I hope it can be. I mean, the report might be as simple as saying where lockers should be located, or that the timetable should be colour-coded, you know, and those things are very important, especially for children who have ASD. So I'm just wondering if that has, and if therapies are now going to be offered again on a regular basis as they were before. Thank you.
Respond to that, Deputy. The experience of families and their children over the last couple of months was a massive reduction in both the availability and actual access to professions that would deliver therapeutic interventions for children. It's well known that the HC had to redeploy a huge number of staff into COVID swabbing centres, and those same staff are actually speech and language therapists, physiotherapists, and the people that we need to work directly with our children. While I'm aware that there's a priority to bring those people back into their current post, I am aware that in certain areas there's been further communication down that some other staff might need to be redeployed into swabbing, particularly in areas where their COVID is deemed to be on the rise. So there's a conflict here about whether we can get those very well trained professionals back into their post, working with children in schools and in home, and indeed doing those types of transition planning, and the needs of the health service to react to COVID itself. In previous committee here in June, we kind of said whatever planning in the HSE, they need to look at permanent workforce related to COVID, and that the therapists do what they do best, which is support our children. In relation to those transition plans that would normally happen in the early part of the year when a child is moving either from preschool into primary or primary into post-primary, or indeed for those children who are actually school leavers with disabilities, there was a major disruption in being able to contact teams, indeed where a child actually had a team around them to provide those. Schools themselves have transition passports, so there would have been information around the child's needs that would have been provided directly by the parents, so not necessarily by an actual health professional. Particularly from the transition from preschool into primary, there's a very good passport that's done for children with disabilities who would be in receipt of access and inclusion model support. So I think from that end it was covered off. Whether the related actual professional reports accompanied it, at least the teachers and junior infants would be very well aware of the needs and strengths of the child coming in. But for children who are transitioning out to adult services from schools, there was a huge disruption to that profiling process that would then dictate. I know we're talking about third level and further education and announcements and leaving certs and all that, but there's a very large cohort of children who have left school this year who faced a major disruption into what they're going to do over the course of the next few years, and that's an area that needs to be addressed for another committee session. So what we are looking for is that we know that there's existing waiting lists anyway, but that there'd be an increase in the number of therapy staff available to support schools. I believe the NCSE has managed to find a way around the redeployment of therapists that they would have engaged with, and they have sanctioned to hire an additional 31 therapists directly. And that just shows that the system isn't working under COVID if your resource can be taken away for something else. So in terms of supports for children in schools, education needs to look at kind of directly providing that special speech and language therapy, and getting the teams back together, Deputy, is essential for that continuity into scaffold supports around the school and the child, and now more than ever.
Yeah. agree totally, Ms Dempsey, and thank you for that reply. It is imperative that those supports are put back in place for the children that need them as well. I would also be quite concerned about, you talked there about the home tuition scheme being only open to those students who have a high risk of contracting COVID. I would be concerned that it isn't open to students under other circumstances as well, because I would have parents who talked to me that they were afraid that their son or daughter were going to refuse to return to school because of being out of school for so long.
Sorry, Deputy
and
Tully,
they need the support on that as well.
your time is up, I'm afraid.
Okay,
Thanks very
you.
much. I'd like to bring in the next speaker.